Hello, I'm Dr. Patel, dentist at Stonewater Dentistry, and today I'm going to talk about crown material, zirconia crown material. Most of the patient we see, they complain about that their old crown has a little black line or black gray shade around the gums, or the color has changed because the porcelain has fractured and now it looks black. Porcelain, those kind of crowns that we see are the porcelain fused metal crowns, and most of the time we see on patients porcelain fused metal crown because most of the insurance pays for that crown. As its name, there is porcelain on the top and metal inside, and the porcelain is laminated on top of the metal, like you can see on this crown. Like you can see, if you can see, there is metal inside and there is porcelain on the top. So because of this, what can happen is the porcelain on the top can fracture because they are glued together. Nowadays technology has improved and zirconia crowns has become a standard of choice. Zirconia crowns are sometimes also a Bruxism crown, where we don't have to laminate it, and it could be a full zirconia metal crown, but it's like kind of like a white color metal kind of a porcelain crowns. And what's benefit of zirconia crowns are they have a superior resistance to fracture, and they can take a normal wear and tear of everyday function without getting any chip on the porcelain, because they are one tooth and there's one crown and there's no laminate or anything on it. And the strength and the superior resistance to fracture give it a higher aesthetic and functionality as compared to the PFM that we see. And nowadays we don't have to grind down a lot of tooth structure when we do zirconia crowns. It's only like 0.5 to 1 millimeter. So what we're doing is we are saving your normal tooth structure, so that is less post-operative sensitive that we see as compared to the PFM, where we reduce 1.5 millimeter to 2 millimeter of the tooth structure. So we're reducing a lot of tooth structure, and that could go to closer to dentin. And when we go closer to dentin, the sensitivity on the tooth normally increases. Also, when I told you guys about the gum metal, this is what it looks like. Most of the patients will say that they see the metal shade around it as compared to this ones. Also you can see the gums are so healthy around here, where you can see puffy. This is the same patients, this was before and this is after. The gums are a little reddish and puffiest. So one good thing about the zirconia crowns are the gums usually like it, and as compared to what we see at the PFM, the gums usually don't get little redness. You don't see bleeding around the gums. So zirconia crowns, the gum stays normal as it should be. And also for the front tooth, when we do zirconia, we can do it for the front tooth too. The light pass through looks normal as compared to the PFM, where the metal blocks the light passage, and it looks like it's little opaque crowns, and it doesn't look like a normal or natural tooth structure. So we can use the Bruxism crown for severe grinder or Bruxism patient, because this don't fracture. They have superior resistant to fracture, and most of the lab, they warranty their crowns for 5 years. So even if it fractures for some manufacturing errors, we can replace it for free. So next time when you go to a dentist and you're getting a crown done, please do make sure that you ask your dentist about the zirconia crowns and see if you can get the zirconia crowns. What most of the offices we notice is they charge a little upgrade fee from the PFM that most of the insurance pay. It could range from like 100 to 250. Thank you.